The following presentation is sponsored by the Cleveland Clinic.
The revolution has begun.
This is really just the beginning. Revolution in healthcare is upon us, and this is going to be the thing that's going to promote better coordination of care, better quality of care, and I think in many ways can help push us to more cost-effective care.
Computers empowering people, doctors fighting to save lives, patients finding solutions. The medical world is changing before our eyes.
The internet has had an enormous impact on medical care and also on patients' interest in becoming more involved in their own care.
Medicine and technology are merging to keep patients safer.
Patients used to have to worry about receiving the wrong dose of a medication simply because they couldn't understand someone's handwriting. When you have an electronic medical record, you no longer have to worry about that.
Patients and doctors are forming alliances to combat disease.
I believe it's helping people make choices in their health care.
Lynn is really empowered now to make changes in her health. I feel like I'm being able to be the coach, but really, Lynn has to make the decisions about her health.
Experience the revolution. It's only a click away. Hello, I'm Monica Robbins. Today we're going to show you how the internet is changing our world. We'll explain how your medical record will go from a paper file to an electronic database that could potentially save your life no matter where you are. We'll witness how technology brings doctors closer to patients, improving the quality of their lives and making them safer. All in this edition of Medical Miracles. Frida Skarloff was in trouble. She had put off heart surgery while caring for her seriously ill husband. Her family watched as her condition grew worse. They finally determined it was time for her to have surgery. So they took her to their local hospital in the suburbs of Philadelphia, Pennsylvania. The surgeon told the family that the bypass and valve replacement procedure would take about 10 hours.
And all of a sudden, within an hour, I would say an hour or two, the doctor appeared. And I knew right away something was wrong.
The decision was basically that they weren't going to do the operation because her heart was so calcified that the doctor just refused to touch it.
They didn't give us a whole lot of hope, and they just didn't, and they didn't really explain exactly what they would do, but it didn't sound like it was gonna work.
They figured she'd probably have a stroke or kidney failure if they tried to do the operation. So they sewed her back up, and she went through recovery just as if she had the operation, but they never did anything.
It looked bleak for Frida. The family had placed their trust in the Philadelphia hospital. Despite the disappointment, they didn't give up. Frida's son Arthur took action.
He decided that there has to be a way. There can't be no answer to this problem.
Arthur got on the internet. He searched using Frida's diagnosis of aortic stenosis. He quickly found the Cleveland Clinic.
A lot of people are going to go online to get information, to seek out the best care possible, because that's really what it comes down to. It. When you have someone, a loved one that has a serious disease, you want to know that you've done everything you can to find the best care. And this is a tool that helps you do that.
What Arthur found was eclevelandclinic.org. Once there, he was linked to MyConsult. MyConsult is a groundbreaking technology that focuses on giving a second opinion.
Well, we had a lot of patients who asked us a very simple question. Do I really have to travel to the Cleveland Clinic to get an expert opinion from one of our physicians? And we realized that the answer was, no, you really don't have to for a large number of diagnoses.
We couldn't get in a car, drive to Cleveland, wait, see a doctor, let him give us his opinion, come home. That wasn't going to happen.
Lynn gathered all of Frida's tests, records, and medical history. She filled out the MyConsult questionnaire and waited for an answer.
And I'm thinking, I can't believe we're doing this. There's no way that over the internet they're going to be able to tell anything.
The staff at MyConsult made sure that Frida's information was put into the right hands.
When the records come in, we go through them, we help to organize them. The records are then sent to the appropriate physician and then have it reviewed to give the patient the best options that may be available, be they medical or surgical. And then the patient's able to review the consultation online.
They sent us this lengthy report, and we all read through it, and when my mom was feeling well enough, she read through it.
So these were the only guys that actually said, we may have an operation that could save her.
were willing to give it a shot. Everybody else was like, she's going to die, basically.
Before the family decided what they should do, Frida made the decision for them.
She said, take me to Cleveland, and her words were, kill me or cure me. She said, if they give me a chance, I can't live like this. I'm not going to live like this. So if I have a little chance of life, just take me and cure me, or not.
Lynn contacted the Cleveland Clinic to tell them that they agreed to go ahead with their recommendations of surgery.
Because she was an e-patient, because she was online a patient, she was a patient. She was already there. They had all of her records. Every time she had a new record, we would send it there, and so they kept up. I think they did a better job keeping up with her situation than her own family doctor.
Now it was a matter of getting Frida to Cleveland. A plane was sent to pick up both Lynn and Frida and bring them to the Cleveland Clinic.
When we put her on that plane, she had less than a week to live.
The clinic's surgeons used their expertise to successfully perform the bypass and valve replacement. To the delighted surprise of friends and family, Frida is still alive, and she's rehabbing her way back to a healthy and quality life.
I feel good I can walk, you know. Even my talking, even my speech was slurred, you know. It's not like me.
I think it's amazing. I mean, just the fact that she gets out of the car and shuffles into rehab, and I get to say, see you in an hour. It's great.
This has been one of the best things that I've done in my life thus far. From a feeling of worth. I started on this project in 2000. I've been with it ever since it was conceived. We brought this thing to life, and we're continuing to make it better. For me, that's very rewarding.
For the family, the best moment hasn't happened yet. The upcoming bar mitzvah of one of their nephews in California will be blessed by Frida's presence and signal the full return of their beloved mother.
I don't think anyone really believed that it could turn out the way it did. Because she literally probably almost died 100 times.
It's a miracle that she's alive. It's a total miracle. Her doctors here that have seen her since, her family doctor, her heart doctor, her cardiologist, they were like, whoa. Every time I describe this story to anyone, they just look at me and say, it's a miracle, isn't it, that your mother's alive? I say, yeah, it is. It is.
Next, imagine looking at your own medical record anytime you wanted. It's not science fiction, it's already available. And later, patients are plugged in and monitored thousands of miles from a doctor, allowing them to live a normal life. A needle in a haystack. Finding your personal medical record in one of these folders is an enormous task, but this is the way it is for most hospitals throughout the United States, until now.
You've seen the medical records department and how humongous it is. Well, imagine all of that information being stored on the size of a server that's roughly the size of a large refrigerator.
Computer technology is transforming your paper chart into electronic data, called the electronic medical record.
Electronic medical record is a system of managing medical information in the modern world. It really pulls it into a computer format so it can be accessed from anywhere, but also allows you to categorize things in ways that make it more retrievable and usable.
So how safe is an electronic medical record? Well, if somebody wanted to look in one of these files, who would know? With a computerized system, you need a password to get in. Without it, you can't take a look.
In addition to having you have a password to log in, the computer system keeps track of everyone who looks at a patient's record, when they looked at it, and even what parts of the record they looked at, what kind of information they saw. You can't do that with the paper world, so it really is a better way to keep your records private.
Security is a top priority. For the medical community, patient care continues to be paramount. The government is interested in making both possible. Recently, President George W. Bush came to the Cleveland Clinic to meet with physicians and spearhead the electronic medical record revolution.
You go to Florida, you get in an automobile accident. An electronic medical record means your data to the doc in the emergency room is transmitted just like that.
The electronic medical record is more than just converting paper into digital information. What it is a change in the culture of medical practice so that we begin to think about using information in real time and sharing that information for the benefit of our patients. Now, we do need computers to get the information in, but once it's in, the real value is in what we can do with it.
And what the Cleveland Clinic did with it was create MyChart, a personalized portal to your own medical record.
MyChart is a wonderful way for patients to get involved in this process by having access to their own health information, particularly medications, reminders for health maintenance activities, health education, and the ability to request things that they may need, such as a next appointment or a refill on medications.
MyChart and eClevelandClinic.org has empowered patients by giving them quick access to information about their own medical questions. Patty McGinley found out that she had high cholesterol. She used web links in MyChart to learn about her condition.
And I was just totally educated by this MyChart that I had never thought I would use. So it was a great experience.
Because of these new innovations, patients and doctors create teamwork.
And they give you the summary basically of what's going on.
It turns it into an interactive document that the patient and the physician can work collaboratively. They work together on their health care.
A patient can log on anytime, day or night, and check the status of their medical record.
And it really empowers the patient to become a partner in the medical decision-making process.
Just ask David Deming. He's an artist who successfully battled a tumor on his wrist. He uses his medical history to keep a better eye on his present health.
When's the last time I had a physical? When's the last time I needed these things checked on? And sure enough, as soon as I registered for MyChart, I realized that I'd skipped a year from my annual physical and immediately made an appointment with a doctor.
Lynn Frizzell has diabetes. She uses MyChart to follow her progress and carefully monitor her glucose levels.
It has made me see what direction I'm going in and to take a little more care and thought into my habits that affect my reading. Because you're visually able to see right in front of you the trends and knowing that if you put in a high reading that your doctor's going to see it and question you. And I think it's just a big help to stay on the right track.
Because the internet is not landlocked, boundaries between patients and Cleveland Clinic facilities are disappearing.
It allows us to be integrated as one continuous medical group no matter where you're seen. So a patient can be seen in Westlake, on the main campus, or in Solon, and perhaps for some reason might be seen at all three places. The information that's available for those physicians is exactly the same, so they have ready access to all the information wherever it's gathered.
Keeping patients safe from drug interaction is one of the benefits of an electronic medical record. The computer automatically cross-checks every combination of drugs that a patient is taking.
In a hospital, we give lots of medications every day. In fact, we do it tens of thousands of times. Anytime you have a process that happens that frequently, there can be errors. Preventing those kinds of errors from happening in a hospital truly saves lives, because these are life-threatening doses of medications that could be given in error.
Future life-saving drugs may be available sooner because of the electronic medical record. The Cleveland Clinic has developed e-research to help scientists get data quicker, easier, and more accurately.
I think it can revolutionize research as it's revolutionizing the practice of medicine.
The accumulated data that's in the electronic medical record helps us design better research protocols. And down the road, that helps all patients who will then benefit from enhanced, more efficient, less expensive clinical research that brings about new and innovative discoveries.
The wave of change will affect us all. In the past, doctors made house calls. Now, doctors will reside in your PC or laptop and have access to your records 24 hours a day. Your medical care will literally be just a click away.
I found it pretty easy. It's step 1, 2, and 3.
I believe it's actually made my life easier because I don't have to visit the doctor as often.
I truly believe that supplying patients with their health information and empowering patients to get the information they need to make decisions about lifestyle choices and about their own health care will enable them to make more appropriate choices, to become the leader of their healthcare team, and to really make decisions that will affect their whole lives.
Next, doctors can check a heartbeat thousands of miles away, anywhere in North America, dialing up patients when Medical Miracles continues. While our lives and our world seems to be speeding up, patients and doctors are trying to keep up by integrating technology into medical care. Security systems can keep your house safe when you're away on vacation. Doctors have created a security system for patients to be safe when they're away from their doctor. It's a service called My Monitoring.
My Monitoring is really a function that extends the reach of the physician to the patient's home or wherever they might be, so that in fact data about the health status of a patient can be assessed on a continuous basis, not just when the patient is in my office.
The reach of the Cleveland Clinic has spread to the entire North American continent to help patients with pacemakers, defibrillators, and resynchronization devices. Merlin Mead lives in Arizona. Sherry Rhodes lives in Ohio. They both use a device called CareLink, a small answering machine-sized device to upload and transmit vital information to their doctors at the Cleveland Clinic. With it, they can travel anywhere in North America as long as there's a phone line.
It's just a small monitor here. Hook up to the wall through the telephone, and it's really a very simple process. And this is the wand, and this wand is simply just placed over the chest where the device is, and it communicates, and when it's finished communicating, you're done, because the transmission doesn't even happen at the same time. As long as it's connected to the wall, it will send it. If it's busy or something, it will send it again later. It's not a problem, and this can be done lots of times. It can't be easier.
The Cleveland Clinic Pacemaker Clinic receives information from pacemakers, resynchronization devices, and defibrillators. There, the doctors can determine if the pacemaker's battery needs to be replaced. They can examine the heart rate of a patient, and they can see if the defibrillator has shocked the patient's heart to put it back into rhythm.
Then suddenly the heart rate went very fast and went below this line here, was detected as a ventricular fibrillation event, and then got a couple of shocks and brought it back up to where it was before.
It's quite comforting to know that we are in the same situation as though it'd be in the office with the doctor, no matter where we're at, in Florida, which we go to every other year, or in Arizona.
The patients who actually allowed themselves to be involved with it, we actually developed better relationships, and they felt better cared for. They knew that we were no farther away than this device that collected the information and a phone call. So no matter where they were, we were there for them, and it actually brought us closer together.
In an emergency, calling 911 can certainly help save lives, but the reality is most cardiac emergencies need quicker reaction time than most ambulances can deliver.
If you have a cardiac arrest and somebody doesn't get there within 10 minutes, then your chances of surviving are almost zero. And in practice, when somebody dials 911, they are able to rescue only about 5 to 7% of those patients. On the other hand, if you have an implantable defibrillator and you have a cardiac arrest, virtually 100% of those patients are rescued.
Sherry Rhodes trusts that her defibrillator works. Her life depends on it. 7 years ago, heart failure began to invade Sherry's life. Every night it took her 30 minutes to go up a flight of stairs to her bedroom. She was constantly fatigued. Her family tried to pitch in. She tried to interact with her children by playing board games with them. But she was heartbroken to be on the outside looking in.
I was pretty much told that we could do some medicines, but we would probably need a heart transplant in about 6 months. I didn't like that answer, so I went up to the Cleveland Clinic, and I went from having the option of waiting for a heart transplant to several different options.
She has a pacemaker, defibrillator, and a cardiac resynchronization device implanted inside of her. My Monitoring allows Dr. Bruce Wilkoff and his staff to make sure each one of those devices is doing its job.
It allows us to detect little problems before they become big problems. The monitoring would be checked, allows us to call her and say, listen, maybe you should come in. Maybe we should check out something. We're not sure if there's anything wrong, but we'd like to check it out.
If I don't hear from them, I know everything's okay, and I just continue on.
It gave her life back, gave her mobility back, gave her strength back, so she can pretty much have a normal life again.
By having a sort of a window into her life, we can allow her that freedom and yet also be able to observe and be able to reassure her, not lightly, but with real information, that she's okay.
I can do whatever I want, whenever I want. Shop for marathons on end and run around with the kids and play basketball and volleyball and kickball and do whatever I want.
For the designers of My Monitoring, the goal isn't just about saving lives, it's also about improving quality of life. They believe keeping patients safe does not have to include unnecessary travel, frequent visits, and wasted time.
We're going to move outside of the four walls of a doctor's office or even a hospital and begin to think about the practice of medicine wherever the patient is, because that's where we're trying to provide the service.
It is just absolutely wonderful to be so ill and then feel so good again. I feel great. Life is worth living again.
When I was diagnosed with cancer,
the questions came rushing in. Why me?
What about my family?
Can I handle the treatment?
What are my options?
The questions just piled up unanswered.
Until I found someone to talk to.
The Cleveland Clinic Cancer Answer Line. Information, advice, support, answers.
Now, the questions don't seem so overwhelming.
The Cancer Answer Line from the Cleveland Clinic's Taussig Cancer Center.
The internet is changing our world by saving lives and providing access to quality care. It's also making our world a much smaller place and opening a door to those who didn't even know a door existed.
There are a lot of areas in this country, unfortunately, where medical care is not as available as perhaps it should be. And so regardless if they're in an urban area or a rural area, the internet levels the playing field, and they're able to go online and get the help they need, irrespective of geography.
I think that the general public needs to recognize that over time they are going to become a full participant in the healthcare process, and information technology is going to enable that.
It was wonderful. I went from feeling helpless to feeling in complete control of the situation.
I think you should be tremendously involved with your medical record. First of all, it helps you understand and ask questions about what's going on with you. So when your doctor gives you news about some major problem, sometimes it's hard to take all of that in. You really need to be able to go back in a more relaxed setting and take another look at the information.
Previous generations of patients and doctors would be envious of the advances available today.
I will be proud of what we've accomplished when I know that we are using these tools to dramatically change the way people are able to manage and control their diseases.
Giving patients connections to answers that bring hope.
Because of the internet, we actually found a person. Talk about a needle in a haystack, 350 million people, in the United States, or 400 million people in the United States. And we were able to find the one guy who does the one operation that saves her life. How cool is that? That's pretty neat.
If you'd like more information, call toll-free 866-819-8326 or log on to eclevelandclinic.org or WKYC-TV. WKYC-TV.com.